Hi, everyone, and welcome back. Today we have a special guest coming on the podcast, Julia Smalls. She is a medical student from Massachusetts, and she wrote an article on the National Council for Adoptees, which is where I found her talking about adoptees in a healthcare setting. And I figured it would be a good idea to reach out and kind of ask her about some of the ways that adoptees can kind of go about the uncertainty they feel when going into a healthcare setting. Kind of ask her maybe how to, navigate that for adoptees. And, we talked about how everybody kind of wants answers for their unknown medical history. And then we also talked about how there might not be answers all the time for adoptees, but how it's important to kind of advocate for themselves and, be kind of proactive in talking about their healthcare with their healthcare providers. It was really good information, and so I hope you all take something away from it and are able to kind of maybe get some answers or just some insights about how to deal with that. So yeah, enjoy. Hello and welcome back to the Culturally Complex podcast, everyone. So today we have a very special guest, Julia Smalls. She is a medical student. She lives in Massachusetts, and I'll let you tell a little bit about what you do and where you're wanting to end up.
Yeah. Well, thank you for having me. So I go to medical school at UMass Chan Medical School, but I just matched into a residency in Colorado, which I'm very excited about,
Yes.
into a combined specialty in internal medicine and pediatrics. And I'm
Oh,
hoping to work with foster care, youth, and kind of people who are at transition ages and helping them kind of transition from the pediatric world to the adult world. So
yeah, yeah, that's exciting.
thanks.
Yeah. My mom is actually an oncologist, so
Oh,
I've
wow.
kind of been around the medical world for a long
Hmm.
time in life, but it's just something that I've never really wanted to go into per se. I've
Yeah,
always had an interest in medicine and the sciences, but I'm just not built for being a doctor, I don't think.
that's okay. It's
Yeah.
it's definitely not for everyone, and there's certainly tough days, but there's many wonderful paths to take besides medicine too.
Yes. And so one question I kind of ask everybody, and you're kind of a budding expert in your field. But one question I ask all the adoptees that come on the
Mhm.
podcast is, where were you born? And then where were you
Mhm.
raised once you were adopted?
Yeah, two great questions. So I was born in Hunan, China, in Shaoyang, or at least that's where I was adopted from. And then I was about 6 months old, and then I grew up most of my life in Topsfield, Massachusetts, which is a very small town north of Boston.
Yeah, that's cool.
Mhm.
uh, yeah, so this, I've asked everybody kind of, about their story and everything. And a lot of the podcasts that I'm doing is talking about just different ways that adoptees kind of, you know, grow once they've, you know, been adopted, and kind of
Mhm.
how they were raised, and whether or not that creates a bit of a disconnect from the culture you were raised in and the culture you were born into. And
Mhm.
um it's been interesting to hear, because I know I've had my own experiences with it.
Mhm.
um and hear that other people have as well. It's been something that's been kind of comforting, I guess, in a way.
Yeah, yeah,
Um,
I agree. Very validating to kind of hear other people who understand your experience because I think being adopted is so unique and niche. And I think just like you were describing within the adoption community, there's so many different experiences. And, um, I grew up in a pretty predominantly white, homogeneous town in a, you know, cow country of Massachusetts. And I think being a person of color that's kind of hard to be in. And being a person of color raised by a white family is even more difficult. So,
Yeah.
um, yeah, I agree. I think when I started reflecting on my adoption journey, which really didn't start until I was like in my 20s or so, um, I think I started to understand how some of the things I struggled with when I was younger really was a reflection of um, just being at this very unique intersection between your family and who they are and how they identify in yourself and your background and your birth parents and all of those things is just really really complex. And um, growing up, I think I didn't understand that, but now that I'm older, I think it's helped me feel more comfortable in my own skin being adopted and what that means to me.
Yeah, I totally understand that. Like, I didn't, excuse me, still like a little
Yeah.
rough from where I was like, but I totally get that because it took me a long time to kind of like realize the effects that adoption had on me and like just
Hmm.
realizing, like I'm not like everybody else that I'm
Yep.
growing up around or that I'm still currently around. Like, everywhere is sort of predominantly white that I've lived. So,
Yep.
uh, yeah, it definitely took me a while to like kind of realize like, oh, it's going to be a little different for me.
Right. Right. I
um,
agree.
and that's kind of something that all the other adoptees have like talked about too, is like their
Hmm.
experiences with that. And then I know like one thing too that a lot of stuff that I've seen is just like with healthcare. Uh,
Hmm.
and that's kind of why I wanted to talk to you about that because
Yeah.
I actually found Julia on the National Council for Adoptees. She wrote an article for them about adoption and kind of like the healthcare setting, and
Hmm.
it's something that a lot of adoptees I think have a lot of questions about, and
Yep.
a lot of uncertainty. And so I definitely wanted to talk to somebody who's kind of well versed in that. So I guess the first question I have for you, or maybe a couple questions, is like,
Sure.
what has your experience been like going into like healthcare settings as an
Hmm.
adoptee, and kind of what inspired you to take interest in that, for kind of going into your residency and everything, like dealing with like foster kids and stuff.
Yeah. Yeah. So I think it's so interesting being both an adoptee and a medical provider, um, because you can kind of see both sides. And I think in terms of what sparked my interest of wanting to concentrate or look more into this and do some advocacy work around it is when I first started medical school, you spend about the first year learning how to talk to patients. And a lot of that is history taking. And I think as you know, I'm part of a program that focuses on the social determinants or social factors that influence health. And that can be from many things like race or gender or sexual orientation to like military status, where you live, what food you can get, all of these things. But um, we would have class after class about all of those factors, but it really struck me that no one ever talked about just the diversity of family in general, or if we talk about race, how there's so much diversity within different racial classes, like, people who are adopted, people who are mixed race. It's kind of a very unique experience that's hard to articulate if you don't, come from those smaller communities. So when I was in class and we were learning how to take a family history, I remember like being like, well, what if someone doesn't have a family history? Like, what do you do? And reflecting back on all those times I'm at the doctor and they either ask me multiple times, like, oh, does this run in your family? And I'm like, no, like, again, it doesn't, but, or I don't know. Um, or just being like a little bit awkward and then being like, oh, okay, I'll be like, I'm adopted. And they're like, all right. And then they just move on. And
Yeah.
I just thought it was so striking that we ask so many questions and delve deep into the research of how all of these other social things can influence your health and your outcomes, but no one ever talks about what it's like to be adopted or what it's like to not have your family medical history in general. So that's what kind of sparked that. And then in terms of um, being interested in working with foster care uh, communities, I was really at the time when I started medical school, I was going through kind of the peak of my reflection of what it meant to be adopted. And I thought working with foster care kids might bring me a little bit more of a sense of belonging and community. But I found it was very, very different being adopted internationally when you're a lot younger than being raised in the foster care system here. And um, I think it brought a new perspective to just kind of the many different ways that adoptees can come to, I don't know, what their journey can look like. So, um, yeah, that kind of snowballed into to looking more into it and realizing how there's so much social risk factors with that population, and really kind of wanting to be a part of advocating for them, and some of the intersecting things that affect them and adoptees as well.
Yeah, I definitely have gotten the same like thing at like the doctor's office where they're like, "Oh, well, what do you know if you have a history of, heart disease or,
Hmm.
anything like that?" And it's just like I have no clue. The extent of
Yeah.
my knowledge about what I, you know, my like health was that I'm not able to get the like bubble test for like
Hmm.
TB because of
Mm.
some vaccine I had whenever I was adopted from Guatemala.
Gotcha.
And
Hmm.
it like that's pretty much it. It's like that's
Yeah.
the only thing that I know. And I feel like it's even a miracle that I got that much information. so
Yep. Yep.
so it's just like, kind of crazy that
Hmm. Yeah.
that I feel like the adopted population kind of gets a little neglected in the healthcare setting in that
Hmm.
sense. Um, because you know I feel like it should be something that's talked about a little more, and
Yeah.
definitely or not a
Yeah.
lot, not even a little, a lot more. um, and that kind of leads me into another question of like, what is there anything like adoptees should be thinking about when like entering a doctor's office? As far
Yeah.
as bringing up their own like questions, or I guess really just like I don't know, just kind of talking about their health in any way, like when going into
Yeah.
a healthcare setting.
Yeah. I think that's a great question. And I'm not an expert on this, and I think I don't know if I had mentioned this, but I am in the process of completing a research study. Um, and it's essentially a patient experience survey for people who are adopted and who are now adults, and just trying to gauge what their experience has been like with the U.S. healthcare system. Um, and I think overwhelmingly there have been about 200 responses, and many of those people feel similarly to us, where they feel neglected and marginalized, and looking for answers. And it's posed a lot of very interesting questions for me, and I think in general for the medical field, that don't have answers yet. I think in terms of what adoptees can do at the doctors, I think that in general, I advise all my patients that they should definitely advocate for themselves for any concerns that they have. And also, the physician or provider should listen and take their needs seriously. But I also recognize that that always doesn't happen. And I also recognize that it's not fair for adoptees to always have to be the educators of their own health. So I think it's really complicated. I think that with my study and in general, I more try to advise providers to do more of the legwork, because I think that there is such a big gap in knowledge. And if a patient feels comfortable about, educating what it means to be adopted to them and what concerns they have and how it's related, that's really great. But if they feel burnt out doing that, then I really think it's the provider. Providers just in general need to understand how these concerns can really cause some harm between the patient and provider relationship if they don't take it seriously and they don't listen. So,
Yeah, yeah. And like uh I guess another thing would be like, do you think adoptees should go into like once they're kind of like old enough to like kind of realize what adoption really like means and like
mhm.
how it might affect them? Do you think that they might should possibly do some of their own like looking into like things that affect their own like population, like maybe because I know like there's certain diseases that affect populations at different rates and stuff like that. Do you think that that's
Hmm.
something that, you know, you adoptees should look into, kind of going into like healthcare
Yeah.
settings?
Yeah, I think so. It's such a complex question, and I wish I could be like yes or no, but it's so hard because there's not a lot of studies that tell you exactly what the risk, for instance, like genetic um, testing is like a big thing that we saw in the answers and responses of that survey. A lot of adoptees really want genetic testing, but I don't necessarily know if that's the answer all of the time because genetic testing, there's so many things we don't know about it. And a lot of times, even if you're positive for something, it doesn't necessarily mean that we can do anything about it or that it will, a disease will come to fruition.
Yeah.
Sometimes people just have those genes and then they don't express them. I think in terms like the social aspect of if someone's adopted from a different country and there being a higher prevalence of certain diseases there versus in the US and if they should explore those, I think it's also really hard because a lot of times um, the increased prevalence or incidence of certain diseases in those countries is because of the diet or because of the surroundings and things like that. So I think it's important to have kind of this global health lens when you see your patients and when you think about, for instance, you were talking about something called the BCG vaccine, which is very common. It's a vaccine for tuberculosis that almost every other country does except for the US. And because of that, some people will falsely test positive for the TB testing. And so you can't trust those results. I think that's important to take into account. So I think that what I would advise adoptees is certainly to kind of look into some of those global health things, but I wouldn't, and discuss them with the provider. And if your provider, you feel like they're not listening to you, then maybe that's a sign that you need someone else who will at least explain to you why you don't have an increased risk for something. Um, but I also don't think that it's something that they have to do such deep digging because I don't think it always will most definitely or 100% of the time impact the person. It's just so hard and it really depends on different ages, depends on when you were adopted, depends on a lot of things like that. But yeah, I hope that answered your question. It's
Yeah.
kind of like a wishy-washy, super vague thing, and I think that in general, the the studies and the data and the knowledge on exactly what is nature versus nurture type idea we haven't fleshed out yet, so that's
Yeah.
why I think it would be on an individual patient basis, and it you need a provider that will explain exactly why it would affect you or why it wouldn't.
Yeah. And like kind of talking about that, like I've even had like I think the only time I've had a provider really talk to me was whenever I was like still going to like a pediatrician.
Mm-hmm.
um and they basically said, there's only so much we can really tell you about like what you could have. Or and they did mention, like you said, like the genetic testing stuff, but they
Mm-hmm.
also mentioned kind of what you said about like the uncertainty of that. And like, you could, like you said, test positive for something, but that doesn't mean you're
Mm-hmm.
necessarily going to get it later
Right.
on. And so I was appreciative of even that much.
Mm-hmm.
But besides that, it's kind of been the same of, oh well, you know adopted, cool, that's it. Like,
Yeah.
and yeah, so it's, you know it yeah, like you said, it's a complicated thing because we don't have all
Yeah.
the answers. um and I think too that kind of like adds a little bit to the like uncertainty that adoptees even feel, because even with somebody who has a full family history,
Right.
they might not even know everything that's going to happen to them.
Right.
um
Right.
but I think
Exactly.
like with being adopted, that just adds like one more layer of like anxiety a little bit with it.
Yeah,
um
yeah. There's so much uncertainty and there's no clear answers, which makes it hard. And there's something in medicine that we term like shared decision making. It's the idea that your patient is basically part of their own care team, which it should always be like that.
yeah.
And having a provider talk to you about the pros and cons of doing something and let you be part of the decision with their, you know, expertise and guidance behind you, I think that's what makes the best physician. It's not someone who knows all the answers, or it's someone that you feel comfortable enough to share what your concerns are, and they include you in what the next steps are, and let you kind of help decide. There's obviously, like extremes to one another. Physicians should not let their patients do something that is, would be harmful to them, or is so unnecessary that wouldn't even be beneficial. But at the same time, if the kind of net outcome is not too harmful or beneficial one way or another, then the patient should be involved in deciding what they, do to their body and what happens with their health. So,
Yeah. Yeah. And sorry, excuse me. My
no,
voice is like so rough from being sick this past week.
that's okay.
Um,
It's cold season right now. It's like,
yes.
all those viruses are coming out.
Yeah, for sure. Especially like where the weather here has been so weird. It's like warm. It was so warm all last week, and then now it's like 30 degrees out. So
Yeah,
it's just
makes
that
it
time
tough.
of year.
All the things that were sleeping now comes out, and
Yeah. And like I think the next question I kind of have, or like something maybe you might have some insight into, is about like, parents of adoptees going into
hmm
like healthcare settings. Because a lot of the times, like when adoptees get adopted, they're fairly young.
hmm
There are also people who are like older being adopted and stuff,
Yep,
but um, you know, a lot of the times going into like a pediatrician's office, the parents are usually there, and
yep,
um, I guess kind of asking about like what you think parents should be concerned about, or like should
hmm
they kind of like educate themselves a little bit before going into a healthcare setting with their adopted child, because a
hmm
lot of the times, like when kids are that young, they can't advocate for themselves, so their parents have to
yeah,
advocate for them.
yeah. That's a great question. So I think things do change a little bit when you're talking about kids, and um, like you were saying, advocating for your child, and I think it changes too in terms of how old the kiddo was when they were adopted and where they're adopted from. Um, and how much their country of origin will impact their kind of health outcomes. So I think when it comes to parents, and say you have, a 2 year old who was adopted from China or somewhere else at 1 years old, um, I think that I would probably recommend that parents are a little bit more educated about the health of that particular country, or finds a provider who has that knowledge. Because I do think that when you're younger and you're closer to having been exposed to some of those things from that country, there's so many things from other countries that are way more prevalent that we just don't think about in the US anymore. And I think, for instance, I was actually just in Guatemala and I spent a month there. And something I learned a lot about was malnutrition is so prevalent there. And I remember having kids that I've seen in the US that were smaller for their size, and I was smaller for my size. And, um, you know, that is kind of a little bit of a norm there. And it's just something you need to think about, why and what do we need to check if they weren't getting the proper nutrition from that country. Do you need to think about exposures that you wouldn't have maybe in the US, in areas that are either middle class or more affluent, like lead? My sister tested positive for lead. She's also adopted from China. We're not biologically related, but she tested positive for lead when she first came here. Um, and it's things like that that I think that parents should just be cognizant of, and just make sure that you are doing shared decision making with your provider and bringing up some of those concerns. Because I think a lot of times, unless a provider is really knowledgeable about global health, it's not something that they're, as familiar with seeing. So I think having a little bit of that education would really help the parents advocate better for their children.
Yeah, yeah. Uh, Yeah, I forgot that you mentioned that you were in Guatemala for a while, and
Yeah.
it's like that's so cool because like I'm adopted from Guatemala.
Yeah,
Um,
yeah.
yeah, and so we're. I think you mentioned you have a sister,
Hmm.
and I also have three siblings, all
Hmm.
adopted from Guatemala, but to
Hmm.
our knowledge, none of us are blood related.
Hmm. Yep.
um, but yeah, I think what you said was really important about like parents kind of having to like or not having to, but I guess trying to get that knowledge so that way
Yeah.
they're informed enough to like say, you know, this is something that's this is my child's health. Like
Right.
I
Right.
need to like you know have some sort of hand in making sure that they are aware and able to take care of themselves like later on down the line.
Right. Right. Yeah, I think even just having the ability, whether the child is adopted from within the US or outside, just making sure that the parent recognizes that their kiddo is not exactly like the rest of, the kids. And they might need a little bit more special attention and just being like, hey, what else do I need to do? Because this is as much as I know about my kid, and how is that going to impact them, and making the provider research it all. I think is just so important. Just making sure someone opens that door to talk about it.
Yeah. And so I guess the next question too about like kind of going from uh like pediatrician's office when you were like small to like
Hmm.
going to just like a primary care physician. I don't really know the exact term, but
Yeah, yeah,
like primary care kind of transitioning from that. Like, I feel like even like from like 18 to like 20,
yeah.
I'm like still like asking my mom, like, I don't know like what to do whenever I go into a doctor's office alone.
Yeah,
Like,
yeah. I'm just a baby.
yeah.
Yeah.
So, um, I guess is there like anything you would say to like adoptees kind of making that transition from like a you know a pediatrician to that primary care office if they're going like kind of going in it alone, like not really
Yeah,
sure what to do and what to
yeah.
ask and stuff like that.
Yeah, it's a great question. And I think even for non-adoptees, that transition is a lot harder than we talk about.
Yeah.
18, I mean, looking back, I'm 28 now. I was a baby. 18
Yeah.
is, uh, it's a pretty stark transition from being not coddled, but really having so much support in, as in your pediatrics world, and then going to the adult side where you're like, you really need to be your own advocate. So it's hard and it's not easy, but I think doing the same thing that your parents were doing and advocating for yourself, and um, if you feel comfortable, I would recommend disclosing to your provider if it means, like, if it's something that's important to you that you're adopted, and you have questions about it, disclosing that so that they're aware, and trying to find someone who's understanding of that, I think is really important. So it's not easy, but trying to be your own advocate is a part of being an adult, and it's something that you have to do at the doctors as well. So again, if you feel comfortable talking to your parents about what your past medical history has been with your pediatrician, bringing all those papers with you if you have concerns, talking about it with your adult provider is one of the biggest transition steps.
Yeah. So I guess the kind of final question I want to ask you
Yeah.
is, um, what would you say kind of to adoptees, like on a personal level, about feeling some sort of uncertainty about their future, like,
Yeah.
about not necessarily knowing what, you know, they could develop later on and,
Hmm.
what things could, cut their lifespan short even. Like that's kind
Yeah.
of scary. So do you have any like advice or words of wisdom for adoptees?
Yeah. Yeah. I think two things. I think one, I would say that, you know, so many other adoptees feel like that. So, just to validate their feelings, to say that it certainly can be scary and they're not alone, and it's something that I would call as normalized among like the adoption community. And I would also say that it's not limited to people who are adopted. I think people who are donor conceived, people who are out of touch with their family, um, many people don't have access to their family medical history. And some people who have it, sometimes it's not even accurate. Sometimes people find out that someone they think that they're blood related to, they're actually not. And, with all of that said, I also do think that there are moments when family medical history is important, and knowing it can maybe change some things. But I think that there's more often than not times when it really doesn't change what we would do medically. And I think it's really interesting because if you talk to a lot of providers, most people, most providers don't ask about family medical history regardless of if someone's adopted or not and if they have it or not. And I don't really fully understand why, when you search on the internet and you search for like lack of family medical history or no family medical history, all the web pages that come up are all these like pro family medical history campaigns where it's like reach out to your relatives, and it's like, well, what if you don't have that?
Yeah.
But from the medical viewpoint, from a provider, it's really strange because there's this really opposing dichotomy where the patients, probably from all this media and these big campaigns being like it's so imperative to your health, to really, there's only certain times when it's important to have. And I think that I totally believe that there are probably people who maybe missed a diagnosis because they didn't have the information, but I think it's more rare than we talk about. So, with all that said, I would hope to reassure some people who don't have that information that, I think I would hope that your provider is doing everything possible without it, and it's maybe not as imperative as we all think it is. I hope that answers your question. And I don't
Yeah.
know if that's helpful to some people, but
Yeah. I think, people can, interpret that however they would feel, I think. But yeah, it definitely answered my question. So yeah, I'm so glad that I got to like talk to you about this because it's,
yeah.
definitely something that a lot of people have questions about, and
Hmm.
I know like personally I had a lot of questions about it too. So I'm very glad that I was able to like do this so that way,
Yeah.
we could possibly answer some of the questions or, provide some sort of insight, I guess. Because like we talked about, like there is not necessarily always a set answer to all of these,
Yep.
concerns. Um, so yeah, I thank you so much for doing this and everything. So yeah,
Yeah. Thank you for having me. This has been
yeah,
so great. And I think the more I talk about these things and meet other people within the adoption community, it raises even more questions. And I think it just makes me excited that there's so many people who are trying to answer them and trying to form this strong community within our kind of niche group.
yeah.